Oh, we have an article, and it's a very important article. Yeah, the article talking about cancer scare, and the doctors reports increase in new cases every week. You know, since we start this program here, we have a real reasoning where we are declare, say, you know, the cigarette thing. The first program we do was about the cigarette thing and cancer thing, and how it prevalent now amongst the youth them. So we have on the radio a lady who is, well, I don't know if we want to say authority, because she's an oncologist. Oncologist. No, I never hear this word before. Pardon me illiterate thing, but good afternoon, Dr. Spence.
Good afternoon, Muta.
All right. First of all, you can just explain to me this word oncologist, because I've never heard it before.
Sure. Well, oncologist, it actually comes from the Greek. Onkos means tumor. So an oncologist is a specialist who looks after people with tumors, and usually those are people with cancerous tumors. So basically an oncologist is a cancer specialist.
Okay, and you are a cancer specialist. Like all right. Mm-hmm. All right. It has been reported that you are saying that there's so much, the increase of cancer in Jamaica is like overwhelming.
Well, what I certainly think that, I mean, it's not just Jamaica. We're finding it across what we call the developing world.
Yes.
But as we're in Jamaica, yes, the increase in cancer, and in particular certain types of cancer, is definitely, I've been back in Jamaica since 2002, and I'm definitely seeing more cancers and more cancers in younger people. And I look after I do most of the government, public sector lung cancer patients. And I think the statistics you're referring to, in 2009 we saw 88 new patients, and in 2012 we saw something like 126 new patients.
You're serious?
No.
You mean in 2012?
The first thing we have to say, though, Muta, is that doesn't mean that, I mean, you see what I'm saying is that it may be that more of them are just coming to the hospital, and that they went to other places before, or maybe they went to university before, and now you have to pay at university, so people are in the public sector coming to a different hospital, those kind of things. So you can't really definitely say.
It's an increase.
An increase, but certainly we are seeing a lot more new patients. They're not all old people, although nobody wants to have cancer, but, some of the people I'm seeing are 35.
With cancer, with actual cancer.
That's right.
And what is the main cause of these cancers amongst these 35-year-old people?
Well, there's many different causes, but lung cancer can catch you early if you start smoking early. I mean, we have people in their 40s, 41, 42, 43, and when you talk to them, they start smoking when they're 11, and they don't stop.
Yes.
And the other thing that was in the article is that the most common most frequently is young men that have been working on construction site, or people who are in farming.
Yes. All right. It's not the farming cause of cancer. It's what them do on the farm.
Not the farming. No, I don't think that is there. What I'm saying is they're smokers.
Yeah, that's what I'm saying. Is what they do on the farm.
Smokers. Right.
Yeah, meanwhile, them farming or construction, them doing the smoking. I mean, continuously chain smoking. Mm-hmm. Yeah, you can see that amongst the construction worker, them really, I mean, them almost like all of them are chain smoke.
And when you ask them, it's they might smoke 10 cigarettes for the day, and then they might smoke 5 spliffs for the day.
Yes.
But what I want to say, I just looking up on the internet, coming on your program, and last month the American Association for Research is actually saying that they don't think that marijuana causes lung cancer. I know everybody in Jamaica are going to be happy to hear that. We're not encouraging you to smoke weed, but it's more the cigarettes.
Yeah, well, we did let out that information on the program, say marijuana really okay. All right, so we could talk about Jamaica really. All right,
yes.
As a person who deal with these people now, what is it that is making the thing become like a chronic thing? I mean, I would know that you say more people is coming in, but at what stage of the cancer, for instance, like a 30-year-old person come to you, what stage of the cancer it reached that you can help them? Can you help them at, when them come?
Right. It's very individual. But what we can say is that our lifestyle is really one of the biggest problems. Yeah. We have moved away from eating food from the farm, food from the ground, that our grandparents used to eat, and we move into what we call a Western or more American diet.
Yes.
So we eat high sugar, high fat, high processed food. We don't do nothing. We sit and watch TV, where before we used to walk how much miles to school and go back again. And, and so the physical inactivity, the poor diet, the obesity, all of those things, and then the alcohol and tobacco, all of those things are contributing to the increased rates of cancer in Jamaica and in the world.
And when you see some youth on the corner drink alcohol and a smoke, and them is like teenager, and you try to show them, say, but what you know? Yeah, not now to you know, but this is the start of the terrible thing when you're reaching your 30s and 40s. And through them don't have no experience and nobody around them who is getting this thing. They might say, well, things free for do, and you try to show them, say, it's not because it's a fool learn from your own experience. You have to learn from somebody else's experience. And you can see what is happening in the society with this smoking. But yet still people, young people especially, is reluctant to understand that it's not going to happen to them. They're not going to get cancer at 15 and 30.
Right.
But then when they reach them 20, late 20s, early 30s, that is when it starts grab them. And you are trying to prevent that now. Is there a way, we know about the habit still, but is there a way to treat so much people, considering the budgetary...
The extent of it. No, there isn't, and we are struggling to treat the amount of cancers we have now. I went to the World Tobacco Day, that's where I did the interview, and they're talking about getting education for 5 to 5-year-olds and up.
5-year-old?
Yes, that young, that you have to be teaching them from that time about good diet, no smoking, no alcohol, physical exercise, because probably by the time you reach 11, 12, we might have lost you. So it's really from very early that the education has to be inculcated, because you're right. When you're 16 or 17, you never believe you're going to die. So why, it's not going to ever happen to me.
Yes. All right. So, all right. As a person who is treating these people, and you say you work sometimes with the government, what do you think should happen in this society, Because we know them to advertise cigarette on the TV, but, what do you think should happen? What is the move that can be made by the government to put in place something that definitely, you say, well, them really making an effort to really help the youth, them to say this thing here is a terrible thing?
Right. Well, this is a very timely conversation, because I think you're going to hear in the next couple of weeks the Minister of Health is going to be launching what we call the National Cancer Plan. And it's basically going to be covering everything from how are we going to do public education, how are we going to do early detection, how are we going to improve treatment, and how are we going to improve looking after people who we can't really cure but are still with us. So it's going to be a huge move, education and public policy. The government has to decide where are we going to start educating. And it's not just about tobacco, it's going to be about diet, it's going to be about physical activity, and they want to even start, getting those programs more into schools, into communities. I'm hoping to see that we're going to see a big push in the next few years. Because what you want to do is to prevent it. You don't even want to see people with cancer.
Start it. Yeah, you don't want them start. You want them prevent it. But
that's right.
All right. Within you see, a lot of times when people push these kind of things, it stays in a certain category. But for instance, now where the masses of the people are, you don't. Apart from like a radio, which people really not take. People, especially in the garrison, they might listen to radio for music and for ear who get chopped up and all them something there. But in terms of projecting this, that the masses, people in the garrison can take it serious, is there a deliberate trust towards making ghetto people understand how serious this thing is?
Well, you have a very good point there, and therefore we have to be looking to use media that people, you know, because it don't make sense to write things in the newspaper people can't read or not reading. I mean, I think the radio is going to be one of the most powerful things. And people like yourself, you know, we may be coming to you and saying, Muta, can you do a 1 month series every day or every other day, whatever, we do a little piece.
Well, I tell you, sir, we have been talking from the first day this program start. That is what we talk about. We're talking about food, and we're talking about the environment, how people throw things on the road, and we're talking about the smoking of cigarettes. That is the main thing we talk about on this program. And we really want to emphasize it because it's a whole heap of young people listen to this program here. But we are saying there's somehow when these when we say government, when the government take up something for push it, it's almost like it's steering a certain group of people. You know, come out like there's no motive, you know, like planting food now. The people them who responsible for plant, them not motivate the youth them enough. For say, boy, I make them go dig some food. You understand? So we need we need voices, and we need marketing strategy that can help for really define to
really get to who needs to hear the message.
Yes, you know, we need. I don't know if I don't know. I need to figure it out. But all right, explain to me in terms of categories and things about smoking, cancer patients and everything there, because you just mentioned about 100 odd. You see, in a 2012 last year, you see 100 odd. In a year, you see 80 and everything there. Based off so far this year, like how much people you treat this year, you can't tell.
Well, when I say treat, but how we have to do it is measure new patients. That's how we kind of look at it. So, I mean, I do a clinic every week at the National Chest Hospital, and we're seeing 3 or 4, probably 4 new patients each week. So, and the year is half done. So you can just do the math on that, you know? So that's like 20 new patients a month.
Yes, and that's in 6 months,
something
620.
like that, you know.
So we're almost gone where we get to last year for the whole year.
Right.
And it's just half of the year you're gone.
So, you know, the question is that because there's more cancer? Is it because the doctors are picking it up and sending the people in, whereas before they never, I don't know. I really don't know. But we are continuing to collect the facts and look at them and analyze them as best we can to understand. But I think back to what you were saying, you know, we need to engage the public, and people like yourself and people who are respected out there who, as you said, the masses and the garrisons are listening to. We need you.
Yes.
You know, we need you to continue and to, you know, we need to engage with you and say, what do you think? What is the best way to get this message out?
Yes.
Yeah.
All right, like you say, you're at the place every week. Is somewhere where you have to pay a big money, or you just go down there?
No, man, we're talking public. We're talking public sector.
Oh, it's a public place.
So
you
right
are at a public place.
A public hospital, that's right. So once your doctor refers you there, right now the treatment is still free.
Yes.
So no big money required.
All right, especially, all right, you know, so man kind of scared. You know, woman will go to hospital quicker than man. Man have the sickness than them know God do not about it. But you find that mostly man really it affect.
In lung cancer, for sure, it's something like 7 to 1, men to woman.
7 to 1.
Yeah.
You're serious? 7 to 1.
Well, you see, it's really the men doing the smoking.
Yeah.
I mean, you might see some cultures where you see women smoking as much as men, but you know, you really couldn't say that in Jamaica. It's more.
Yeah, in Europe. You know, when you go Europe, in Germany, other places, there's some serious women smoking.
You might see more women smoking.
Yeah.
But,
all right. Yeah, the 7 to 1 ratio we talk about. All right, the man them come there. Is specifically you can you detect what caused the cancer, like if it's asbestos, if it's cigarette, if it's, you know, just looking upon a woman. You can't expect you can detect what caused the cancer. Just cancer.
In anybody or or
anybody.
I mean, basically, what you do is you take what we call a history. So you sit down and you talk to the person, and you find out, you know, what is their habits? Do they smoke? What work they do? All of that. And then, I mean, you can never say 100%, but if somebody has been smoking for 30 years and now they have a growth in the lung and it's a cancerous growth, it's probably because they were a smoker. All
right, suppose them work in a place with asbestos there and them smoke enough cigarette, or you can't tell which one of them cause it.
Because asbestos causes a different type of lung cancer than tobacco.
Okay. All right, explain that to me.
Well, asbestos causes a type of cancer that affects the lining of the lung, the outside. The lung is covered in like a thin skin. And that is where the cancer that asbestos you get from working with asbestos for many years. And the name of that cancer is called a mesothelioma.
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 Okay.
And the people we used to see, we don't see it that much in Jamaica, but when I was working in the UK, I used to see it in people that used to work in ships.
Yes.
How they use it for lagging of pipes, and people who used to work in construction in the old days when all the houses had it in the roof and so on.
Yeah.
But now it has more or less been banned, so you don't really see so much of that again.
All right. So this. All right. What you can tell a person who smoke directly, or the person who, because we know the second-hand smoke also can affect you too.
Bad, right?
Can you tell that if a person say them don't smoke and them come with a cigarette, what we call now what cigarette cause, and them say them don't smoke, but I don't smoke, you say yeah, but you have cancer and the cancer is caused by cigarette.
Well, what you do is, again, you take the history and you say, okay, so where did you grow up? And, did your father smoke? Did your mother smoke?
Okay.
Did you, sometimes we see women no family history of smoking, but then when you check it now, they're very rural and they've just been cooking over wood fire for 30, 40 years.
Yes.
So that's not good either.
Yeah, especially the pitch pine wood them. Because you have some people that cook them food and I use pitch pine wood, what we call pine wood, where come from the wood lumber yard them. But all right, you're in a house and the mother smoke enough. So you say one of the main things that can cause this youth, even if the youth don't smoke, is because the parents in the house that smoke and them inhale the cigarette. So them eventually can become cancerous over a period of time.
Yes, I mean, the thing about cigarettes is it's one of those things that not everybody who smokes hard is going to get cancer.
Yeah,
all
we know
we can
that,
tell you is that it increases your risk quite drastically.
Yes. But what we might say is that if you're in a house and the parents are smoke and the youth in there, it means we should have some legislation against parents who smoke in them house when them have young people in there. You don't think so?
Well, that would be nice, but then that means government is going to be controlling your life in your house. I think what we're going to see is
but them
very
going
shortly that you can't smoke in public places.
Yeah, well,
what you do in your yard is a different thing. That's harder.
Yeah, but them have laws. But till they say if you have to something in your house and you go in there, you can arrest somebody. The man them just go in our house up a Stone Hill and find some herbs in the house, and them go in there, go take out the herbs and lock out the people them.
Yeah, because that herb is illegal. Tobacco, until now, is not illegal.
So to me, I find that a contradiction still, because
I agree.
If this thing our cause problem later down the line, and you is allowed to kill your picnic slowly, why shouldn't it be something legislated against, like any other thing? Like if you find herbs in a man's house, you lock him up. I mean, it not kill nobody, but you lock him up still because it's illegal. It should, and you go in at the man's house, go take out the herbs. So well,
it's kind of ironic, isn't it, that the tobacco that causes the cancer is legal and the weed that does not cause it is not legal.
Right, is that what I say? So,
but I'm not here saying that we should really legalize it. Although that's another whole different.
Yeah, no, we understand. We don't say that. But the irony of it.
Tobacco is difficult because it's so accepted. It's such a socially accepted thing, so it's very bad for you, and it's going to be a long, long time before. I don't ever think it's going to be illegal, but at least you can see countries where they're really, the tax on it is so high. Yeah. You can't smoke in a public place, and they're really getting very strict.
I think we should do that in Jamaica. We need to hurry it up. We need to hurry it up to stop smoking in public places.
Before this year is out, I think you're going to see that law is passed.
Yeah. I was reasoning with some people that day them come from Morocco, and them smoke a lot. The Arab, them smoke. No, but the thing is that me push the box in front of them and say, you read the box? Them say, that make us smoke more. The box mark, smoking kills. And people actually read the box and ignore the box. That is ironic.
Yeah. I think we have to understand that it's a drug. Nicotine is a serious drug. And once you're addicted to it, you really don't care. Yes, and anybody can tell you anything at all.
Yeah, you know, I listen to them.
You know, I mean, the only time I had a good friend who was a smoker, and he does smoke, you know.
Mm-hmm.
And I'm saying, you know, friend, look at yourself. You're a little bit overweight, and it's only the day the man have a bad heart attack. That's the time the cigarettes put down now, when it's really in your face.
With a problem, yeah, that is the problem with people, you know.
Mm-hmm.
When the thing get chronic, then them, yeah. Anyway, we really appreciate you to come and say what you say here, because really and truly we need some serious trust against this thing, you know.
Yes.
It get away and it make you. I was reading. I think as you said, I was reading somewhere you said why. You know, he's a doctor and thing, but you'd prefer not to see any cancer patient than to see so much cancer patient.
Well, no, and the way the lady wrote it, it sounded bad, because what I said was, wouldn't it be nice if I was out of a job, because then there would be no cancer
patient,
But she wrote that I didn't like to look after cancer patients, which is not.
No. I never did interpret it that way. I never interpreted it that way.
I just love that there was no cancer to treat. That was
Well, it's like police.
And then I could do something else, like be a farmer and not smoke.
Yes. All right. Well, give thanks.
All right.
Yeah,
anytime.
Yes,
Thank you for having me.
Yes. Yes, that is a lady who know every day, at least most days of her life, she spend dealing with cigarette smokers and other things that lead to this serious problem. And people don't want to take it serious. You know, we keep emphasizing it on this program here continuously, and we don't know. We not stop emphasize it. We not stop emphasizing it because really and truly it gone away. It gone away in a Jamaica. Really, it still away in a Jamaica. And when we look and really, as the lady say, maybe it's not more people, but considering how much people should see this year already, which almost gone more than what you see last year in the whole year. 20 people a month, 20 times how much month gone? 6, 2, 6 is 12, 120. On average, 120 people she see. And last year, she see 126 for the whole year. You know, see it? So it's not a joke thing. It's a serious thing we find ourselves in. So we are asked to warn them again. We appeal to, no? Especially the youth them, where we say smoky. For really look into your life, you know. At 16, 17, I only part the things them where we go to attack, you know. Say, boy, Muta, it's like when we hear Vibes Cartel, one time someone had asked him about the bleaching thing, and he must say, him not see nobody are dead from bleaching. And 2 weeks after we hear about three people dead from bleaching, because you not see nothing go around you as a youth. It no means that the thing now going to affect you down the line. So we are say down the line is where we are work with. You don't want to start something when you're in your teens, and then when you reach your late 20s now, because you have to do something when you're in your teens. So what are you work with? Work with I realize experience teach wisdom, but it's only a fool learn from his own experience. And if you did have people around you with see, I understand, like all this lady I know, we understand, say, look here, you start the thing from an early age, you're not going to see the effect of it when you is 13. You're not going to see the effect of it when you're 14, 15, 16, 17. You see, when you just start to live your life now, and you really decide you're going to live your life, and you say, all right, now, you know, you get a nice job, and, you know, your job, and you get managerial position, and you have your Benz a driver, your house a driver, your woman them and all of it, and then when you go for doctor, go get check up. You hear say, well, you know, so we see a little thing in there growing, a little tumor. You say, what that now? They must say, why is that cancer develop? Your lung cancer. You know what caused that? Because when you was 15, your smoke come right up to now. So prevent is better than to cure. And you know them say the watchman say the danger and don't want the people, the blood of the people will be on his shoulder. And we are say, as you listen to me in this thing, you know, you see that thing the way you have in your hand? We call it as Rasta cancer stick. You see that cancer stick thing there? Mixed with the alcohol thing there? As a teenager, as a youth in your 20s, and you know say every man I talk about, well, everybody no much dead. Watch a man. People that talk about everybody no most dead, just like the Christian them we are talk about, dead and go to heaven. Nobody now going to stand up in front of one big trailer truck and Mandela Highway and make the truck lick them down. You understand? And every day you get up, you try to prevent it. Human being is the only creature upon earth when most of them are go dead and get up every day and try to prevent it. Because most of the things that you do in your life every day is to prevent going to doctor and prevent dying, even though we know so we are dead. So the death is not the problem, It's the continuous going to the doctor. You have to find money for go to the doctor, and the pain and the agony will come through this idea. So, heed the call. We understand how it go. We understand youth, you're vibrant and nobody can say nothing to you because you do what you do and all them way there. But trust me, you did hear, You did hear. You can't say never hear again, You did hear. Where there was pure music, now there's a voice. And the voice, I tell you, say, you see that little stick the way you have in your hand, and you see that little thing the way you have in the cup there, it's poison. And all you know say it's poison, look on the box. Look on the box. The man will make it. Agree to put that on the box. So there must be something. There must be something that is wrong if a man upon the box. So there must be something. There must be something that is wrong if a man have a product and him put it on the box say to go and kill you. How can you ignore what the man who have the cigarette put on the box? Because if you go buy a brand new BMW, and you see in the BMW say, smoking in this car will clog up the engine. And your brethren come in at the car and smoke cigarette. You're not going to smoke in the car, You're going to tell him, say, brethren, me just buy my car, and see it's a X6. Or you come and smoke in the car, to the sign. The sign say, it will clog up my engine. You think you can pay for this? But it's like your body you work with. And you really refuse your body. And then you hear the people them say, which is a quote, knowing not that your temple, that your body is a temple of God. If your body is the temple of God, or you go around the place and at the fire and every day you talk about God. That means there's something wrong with your mind. If a man put it, smoking cause cancer. Because there was a time when them just put a little writing, but no, the biggest writing upon the box. Have sense, man. Wake up, man. Have sense. Look on the box and see what I say. And then you realize how stupid you is. For really ignore the box. Because material things, you not ignore. You not ignore the car. If the car did say that. If you did buy a machine and it said that upon it, said don't smoke round this machine. You're not going to ignore it. You're not going to ignore it. All them man who drive them big tank and with a gas and they say, naked light. One time I wonder what they talk about naked light or night light can naked, but I realize what they talk about. So I say, you cannot imagine a man strike a matches in a gas station and throw the matches on the ground. Right away, everybody run, come turn up on it, Because the thing about naked light, to the light, the thing about naked light, no naked light. You understand? So we are say, really and truly, this is a plea, this is a cry out to the youth them who realize life is precious. Life is something where, trust me, believe you me, no care how dreary and dung the thing look, Everybody, life is sacred to them. And your life must be sacred to others too. So we just say, read the box and take the box serious because the man put it there for a purpose. Stepping razor, the art of war.